and welcome to this episode of Conversations in Health and Care Improvement. I'm Amar, Chief Quality Officer at East London Foundation Trust in England, and a forensic psychiatrist by background, and also the National Clinical Director for Improvement across the NHS in England. Today's episode is going to be focused on the topic of sustainability, and I'm really pleased to have with us today two people who are going to help us think about the topic of sustainability, why it matters, and also how we can bring our learning about how to improve health systems to the topic and concept of sustainability. So, Francis and Parvini, thank you so much for joining us today on this episode. I wonder whether we could invite each of you to say a little bit about yourselves and your background and why you first got interested in sustainability as a topic. So, Francis, let me come to you first. You're the medical director at the Centre for Sustainable Healthcare. Tell us a little bit about yourself and the centre and how you got interested in this topic.
Yes, that's right. Thanks, Emma. Lovely to be here. So I'm the medical director at the Centre for Sustainable Healthcare, and we are a small organisation. We've been going since 2008, and at that I joined really quite near the beginning. So I was at that time I was a junior doctor or middle grade doctor working in the NHS, and I was in training in kidney care. But at the same time, I'd been worrying for quite a number of years about the environmental crisis, and I suppose I sort of thought, well, I'm doing my important work as a doctor, and other people are sorting out the global environmental crisis and climate change. And as I carried on with my work, I just kind of felt like actually that's not what's happening, and like we're working really hard to make patients feel better and make them better, but actually the society that we're all living in is sick, and I need to try and look at that level. So I took a year out initially, and I joined what was just starting up and became the Centre for Sustainable Healthcare. It's an independent charity. And we work in the UK. We're based in the UK, but we work internationally, as you'll hear, because we've been working with Bavini and other places. I guess my role has always been from the start to bring very much a health professional perspective to the topic. I think at the beginning the focus was very much on estates and facilities, and I wanted to kind of help to translate sustainability thinking into frameworks and ways of thinking that would make sense to healthcare staff.
Fantastic. We'll look forward to hearing a little bit more about some of your work in a moment, Francis. And welcome also to Parvini Gohel. And Parvini, you're a practicing physician. I just found out you grew up in London, trained in London, but now you're living and working in Canada. But you're also an associate professor, I think, aren't you, in the university? And I've been spearheading the work on environmental sustainability in your part of the world. So tell us a little bit about yourself and what drew you into this field.
Thanks, Amar, and I'm really glad to be here with Frances because we've been working very, very closely with her team, and it's been such an exciting journey for us. So, I'm a hospitalist physician. It's a very much a North American term. Essentially, I work as an acute care physician in the hospital, and I'm also the section chief for medical inpatients. So I oversee my whole service in the city, which is about 800 beds, and about 150 physicians are under my portfolio. I'm also leading a lot of the work and the strategy, I would say, for Alberta Health Services, which is our equivalent of NHS in the province of Alberta. We're the only provincial health authority across Canada, so we're pretty large and cover very large geographical space. And so I'm leading a lot of the work in environmental sustainability and resiliency. And my interest sort of came from this because I also do a bit of global health work out in India and Pakistan, and so the devastating effects the climate change is having in these communities. And so I came back here thinking, what can I do? And what's interesting, because I was doing my diploma in global public health, and actually it was Frances's lecture that she had done at the University of Toronto that I saw, and I was like, oh my goodness, we have quality improvement embedded everywhere across AHS. And it's such it's such a key part of the work that we're doing that I think there's a way that we could embed this. And we know that our healthcare systems are big emitters of greenhouse gas, and I thought, well, what can I do here? How can I put my global health hat on? And this is where we sort of got interested and then started working with the Center of Sustainable Healthcare, became part of their academy, and we actually ran our first sort of green team competition. And so, of course, using my clinical professor hat as well, we're now sort of looking at the evaluation of this and sort of how this is sort of impacting our systems and how this is impacting our people that work within AHS.
Amazing. That's great. So lots and lots of experience of adopting this in your own system, which I think we'll want to find out a little bit more about in a minute. I wonder whether, Francis, we could take a step back, though, right to the very foundations of this topic. And could you help our listeners to sort of draw the connection between health and care and the global climate crisis? What is the connection between these two things?
An absolute fundamental underpinning of human health is a healthy environment. We depend on functioning ecosystems that provide a stable setting for us to live. They provide everything that we rely on: water, air, food, security, and so the global environmental crisis is threatening all of those things. So it really couldn't be more serious for health. But even on a much more local level, you have very immediate health impacts from some of the activities that healthcare, produces or is responsible for. So air pollution around hospitals and a lot of impact on through the supply chain as well, and the employment of people around the world in producing products and services that are then used in healthcare. So it's actually it's not really distinct from social impacts as well, that the environmental and social impacts arising from the provision of healthcare. And both of them are obviously very important in terms of their impact on health. So that's a fundamental thing, is health, the environment's really important to health, basically. But the second thing is that healthcare is a significant contributor to greenhouse gas emissions. So about 4.5% of global emissions are from the healthcare sector. And so healthcare systems have a responsibility to reduce that. They also have a big opportunity to be part of a sustainable transformation for a wider society and transition to economic models such as the circular economy principles, where you retain and reuse materials in use for as long as possible and avoid waste and things like that. So we have this opportunity as a big employer, a big purchaser, and a very respected sort of set of institutions, to be part of transforming our wider society. So, and I guess the third thing to say is that the health systems themselves are vulnerable to climate events and extreme weather events, and to increasing burden of disease that's created by people, whether it's through changed disease patterns or from infectious disease, or whether it's due to mental health impacts of flooding, for example. You've got an increase in demand for healthcare. So health is fundamentally dependent on a healthy environment. The healthcare system should be playing its part in maintaining, protecting, improving that environment.
Mark, can I add to sort of Francis's point? Because we are on the doorstep of this. So Canada just recently goes through its wildfire seasons. We just had Jasper essentially just burn to the ground, and the carbon emissions from that and the health effects. Usually in the summer we get a bit of a break. As a frontline physician, my team often has a bit of a break over the summer. We don't see as many patients coming in, but we are seeing this every single day. And over the summer, we were seeing pneumonias, worsening respiratory illnesses, cardiovascular effects as well. And we're on the doorstep of this. And, we are also having an impact and we're accountable to our patients. And that's where it's really, really important that we really have to step up. And it's not just the short term effects, we're seeing the long term effects. I mean, if you look at our lung cancer rates in Canada, they're actually a lot higher than other places where there's a lot more smoking incidents. And I think a lot of that has to do with the long term impacts of wildfires. And for Alberta Health Services, we had to evacuate. We have the costliest disasters occurring in Alberta right now, and it's costing the healthcare system a significant amount. So we have to be resilient. We have to support our healthcare staff. But we're also accountable to our patients as well for explaining why our admissions are so high as well.
So our health as a population is dependent on a healthy environment, and the change in the environment poses risk to us, and our healthcare organisations. But also, the industry we work in is a major contributor to the change we're seeing in the climate. So I wonder. I mean, it's a pretty clear argument there for us to be doing something. I just wonder what both of your experiences might have told you about how easy it is to make that case within the healthcare system for, with the limited time and resource and leadership attention we have on things, to really prioritize the environment and the climate amongst all of the other things we need to think about and work on. What have you found has been helpful in making that case within the health system?
I think the context has changed over the time that I've been working in this. I think actually the political climate has made a big difference. So right when we started out, 2008, the UK brought in the Climate Change Act, and finally climate change was being taken seriously across a lot of organisations and across government, with every sector expected to produce a plan for both mitigation and adaptation to climate change. And at that time, organisations or leaders within the system it was a very new topic to them, so they didn't really know where to start, but they were starting to take it seriously. And then actually with the kind of financial crash and a lot of reorganisations in the health service, and then with COVID and staff pressures, it can be really difficult to help people to really prioritise this. Interestingly, I mean, there were a lot of financial cost savings to be made by thinking about the way that you use resources, and I think that can be helpful. But I've actually found that the probably the most compelling case for tackling this has really come when you've put together improving care for patients and reducing inequalities while also improving sustainability. And I think, it makes sense to me because that is what is the primary driver for people working in healthcare. And I think, another thing that has also been very helpful has been when you've seen the enthusiasm from frontline staff and how it brings new energy to their efforts to improve their service. And also, I think, gives a certain amount of agency and autonomy to staff when you encourage them, give them permission to work on this and to align some of their work in the workplace with their personal values. And I think at a time when the health workforce is so strained and stretched, anything that really improves morale and capacity is really valuable. So I think those have been really useful ways in for our work.
I've seen a big change even in the last decade, Francis. Just to reinforce your point around the personal motivation of people, particularly younger generations coming into the health and care workforce, about how passionately they care about the environment and the climate, and it being really high up on their list of priorities, what they want to make a difference on. Ivan, any reflections on your experience in Alberta health systems about trying to make this an important thing for everyone to be considering, not just the senior leaders, but clinicians too?
Yeah, I mean, It's interesting because the National Health Service is definitely ahead of the curve. In COP26, many of the countries signed on to a net zero healthcare system. So did Canada. And unfortunately, we've remained quite stagnant. Australia just released their national strategy just this month, actually, and they've got a very similar structure to us where sort of healthcare is managed at a state and territorial level, and the federal government oversees everything else and provides that cash transfer. We have a very similar structure, and because of that fragmentation, we have been very behind. As much as Canada was seen as a leader in climate change when Trudeau came into power, we've really become quite stagnant, unfortunately. And because we have so many different provinces and territories, different provinces are doing different things, and it really depends on the political will. I think climate change is a sensitive issue in Canada um, for numerous reasons. So it's actually a lot more harder. And I would agree with Francis that, there is, if you have the right political leaders pushing this, then, you can push a really good strategy. And we've seen that in British Columbia. Within their ministry, they have three different ministers working towards this goal and have managed to change each individual health authority. In Alberta, it's been a little bit more challenging because we do not have a plan. We don't even have acknowledgement of this issue. So it's really been left up to us as frontline leaders, as well as senior leaders, to push this agenda forward. And I would say there's two arguments. We know the spending of healthcare is increasing and it's going to continue to increase. And that, of course, increases your greenhouse gas emission. Every single healthcare system wants to cost contain. So the argument that we've really made, and the work that we've been doing in quality improvements helped, is the cost argument. You cut the carbon, you cut the cost. And we've seen that with numerous incentives. So we've been working closely with health economists to look at green dollar savings, not just cost avoidance, money that you can actually take out from your supply chain and sort of put it back or put it somewhere else. And so we've really had to look at the cost containment argument, and it's been actually quite compelling. And the other thing is the morale. Right now, our workforce are burnt out. They're exhausted. They're tired. And recently, with the work that we've done, we've seen the opposite effect. They are environmental stewards. They love this work. They're passionate about it. They just don't know how to bring it into their workspace. They do it at home, but it's like, well, it's healthcare. There's almost like this barrier between work and home. And they now understand, well, actually, we can bring this into our day-to-day work. And we've seen this energy that we've not seen in a long time. It breaks silos, and you get this social unity. I mean, I, as a hospitalist physician, would not be working so closely with the surgeons apart from, my sort of other leadership hat. But we're breaking down walls and we're collaborating and socially uniting on one single front. So we've seen this huge bottom swell, which is important. But we need the top down approach. We need policies and we need financial investments to actually create further interest in this and to actually sort of push this work forward. And that's where we're sort of lacking right now in Canada, where I think Australian NHS is definitely ahead of the curve. We're getting there. We're getting there, but it's been a slow for us right now in Canada.
There's no doubt leadership, belief, and attention to this to be able to shape some of the incentives and the policies is going to be critical. I guess, I imagine people listening to this will be wondering, okay, so there's lots of things here that I can't influence, that people much more senior than me will need to do something about if we're really going to have an impact on climate. So I wonder how we might sort of do what you've just described, Parvani, and capture the imagination of clinical teams and even administrative teams working in healthcare to try to figure out what they can do something about to make a difference, even a small difference, but a difference. What have you got any stories or tales you might want to share with our listeners and viewers about examples that a team has found an opportunity and done something about that has actually made a difference and they feel really proud about?
I can jump in because we just recently ran our green team competition. Francis was there as one of our judges, and it was just phenomenal what the teams did, and it was just so exciting. So our journey with quality improvement has been a really interesting one and a really exciting journey, because we were like, well, how do we take this big issue and look at tangible ways of doing this front line? So we've developed an operational framework of frontline strategies, and one of the core things that we've looked at is quality improvement. And we have quality improvement councils embedded at every single hospital across the whole province, as well as we have councils sitting within what we call each of our zones as well within the province. So we have a really strong quality improvement sort of mandate within the organization. And we have our own Alberta Health Services Improvement Way framework. And what we did was we said, okay, well, let's start off in one hospital and sort of embed quality improvement. And we did that with sort of myself being trained and our quality improvement consultant being trained. And then we decided to launch what we call our green team competition. We had 6 teams compete and sort of go through the quality improvement process and embedding sustainability. And they did this project in 10 weeks, which is shocking. It's not a long time, but the passion that we saw there was just unbelievable, and they were just so excited. We're used to looking at sort of health outcomes, but when you start looking at the triple bottom line, the financial, the social, and the economics side of things, it really resonates with our staff. So a project that was done was by our emergency department. It's a very, very simple project. Initially, they were a bit reluctant when they sort of signed on. They weren't sure. They had some preconceived ideas of what they were going to do. And they came up with a project where instead of putting a drug called ketorolac, which is a pain medication, that is our third highest IV medication that they use in emergency, instead of putting that through a mini bag, they were just going to push it. And a very, very simple project. And they did that over 10 weeks. We changed our whole electronic medical system because we have a provincial wide electronic medical system, which is Epic. And they changed the order, made a simple change in Epic, trained the nursing staff, and they eliminated the mini bag. And they saved a significant amount of money, but also saved 24 hours in nursing time in a month, which is huge. And plus, the patients weren't attached to a pole, and they eliminated that waste and brought down their carbon footprint. Such a small project, which now they're like, we need to spread this within the zone and provincially. So now we're looking at other drugs. So how that small little project, simple, is now going to spread and scale right across the province. I mean, that's an example of something so small and impactful that departments can do.
Fantastic. Francis, any stories that you want to share where you've seen a clinical team or an admin team do something different?
Yeah, I mean, I think that example of the IV push rather than a bag is a really good example, because a lot of times the teams arrive for the green team, their workshop, the green team workshop, to help them think about what project they might do, and they're not quite sure where to start, as you said, and they very often think about waste and recycling. And it's when you kind of look into it with them and kind of educate them that actually the environmental impact of the equipment is happening before they've opened it. It's the manufacture and all the natural, all the resource extraction and everything, the manufacture and transport of that thing and packaging. And so by the time they're putting it into the bin, they're only influencing the sort of the last 5% or something of the environmental impact. So if they look at the equipment they use and they can find opportunities to use less equipment to deliver the same drug, in this case, or the same procedure, or just things like not opening packets until they're definitely going to use the thing, rather than setting up a trolley with lots of things and then only using some of it. Other similar, projects like that take place in all sorts of different settings. In dialysis units, people realised they would always hang up a bag of saline to prime the machine, but the machine actually has the ability to prime itself using the dialysis, the water and the fluid that is supplied to the machine for the dialysis. So it's a similar example, and I think The other thing that's really helpful is we have these principles of sustainable clinical practice to help you kind of generate ideas of things that are likely to be benefit health but reduce resource use. And the first one of those is prevention. And a lot of times teams don't think they have that much ability to do prevention because of where they sit in the system. But in fact, if for example, there's a team we worked with in the Christie Hospital in Manchester, which is a cancer hospital, and they're doing radiotherapy on oral cancers, and they found that they could prevent mucositis. It's very painful and has a lot of knock-on effects, and often people needing admission for feeding and things like that, and they could prevent it using this photomodulation therapy, and they introduced that into their standard care, and they evaluated the impact over again, it's these short time frames, but you can get a picture of what's possible and then model the effects.
Well, one of the things I'm quite curious to hear your perspectives on is the relationship between quality improvement and sustainability, and you've both talked about ways to help people really delve a bit deeper, think about how they might use some of their systems thinking and approaches to quality improvement to actually tackle things that have benefit for the patient, for the organization, but also for the environment. I just wondered if you could say a little bit to our audience about how people might use their already honed skills in quality improvement and then really integrate sustainability into it, because a lot of people listening on to this will be improvers who have already tackled safety issues or flow issues and are well familiar with quality improvement. So what could they do with that set of skills?
Yeah, I mean, we've developed a framework which we call SUSQI for integrating sustainability into quality improvement, and it's got 4 real steps where you can integrate sustainability usefully. So one is when you're setting goals. So explicitly, we're setting out here to improve the service from the point of view of the patient care and for the triple bottom line, so the environmental, social and financial costs or impacts, and you sort of get everyone on board with that goal. The second thing is when you are studying the system as it works currently, you can start to study the environmental impacts and we call the carbon hotspots, the bits which are really contributing the most environmental impact in a given process. So we have some prompts for that, like, where is their travel, where's their energy use, where's their equipment use in this process that you're looking at. And also some bits of information that are really helpful, like if you know that pharmaceuticals have a high carbon footprint, you can be like, okay, are there opportunities here where we could reduce wastage of pharmaceuticals or ensure they're being used in the highest value way, and particularly certain things like inhalers or the anaesthetic inhaled agents that are really, really high carbon footprint. So carbon hotspots, and then when you come to designing your improvement, we use these principles of sustainable clinical practice, which can be really good starting points. So prevention, empowering patients, so your care is patient-centred, and you help them to care for themselves as much as possible. The third one's lean, which people will be already familiar with. And the fourth one is low carbon alternatives. So when we've got actual data that one thing is greener than another, like a remote consultation, for example, is greener. So if there are places in your service where that's useful, like an appropriate, you can look to put that in. So that's helpful in getting people started with change ideas. And then the fourth stage is measuring impact. So we explicitly set out to measure the impact on carbon footprint and social impact where we can as well, and financial cost, and present those as a sort of holistic set of measures alongside clinical or quality outcomes. So there's lots of tools and templates if people want to look them up, if they go to susqi.org, so I recommend people to go and have a look.
Fantastic. That's really helpful and very practical. It really integrating sustainability thinking into the different stages of doing quality improvement, and a great resource on the Centre for Sustainable Healthcare website, susqi, to find out more and get some templates and advice and help with that. Anthony, I'm curious about your experience of really bringing this into what sounds like a pretty established quality improvement infrastructure in your health system. How has that gone? What have you learned?
Yeah, it's been really interesting because we do have our we call it the AIW framework, as I mentioned, which is the EHS improvement way. So what we actually did is we took the SUSQI framework, and it's not a replacement. And that's thing I think one that everyone needs to know, because the fear is you're replacing it. But actually, what we did was we actually just embedded on top. And it was really interesting because we took their framework and then we said, well, this is our framework. And we said, well, this is where each of these sort of processes sort of fit in. And really, the biggest change that we actually found was the process mapping that we did. So when we actually process map, we were again looking at the triple bottom line, which is the environmental, financial, and social impacts. And then, of course, when you're measuring, we were looking at measuring all three. And it's been really interesting because when we have reported it with the triple bottom line, there seems to be this interest, and things just click for people. And actually, we don't always realize the other impacts that we're having in the projects that we're doing, or maybe some of the unintended consequences. But it's really helped us sort of move projects now from local region to actually more to provincial and zonal for us, because we've realized the impacts aren't just patients. It's actually much more wider, specifically the financial, because there's that cost containment, but also reducing that carbon footprint. And we've also, so what we're doing right now is that we're training a lot of our individuals. We are working not just within a zonal region to try to spread and scale, because spreading scaling this is very different in Alberta versus say in the National Health Service. We know that we need to sort of look at the implementation piece of this. um, and there's a lot of interest, and there's a lot of interest at a provincial level to sort of look at how do we embed these principles now in our overall framework, and sort of maybe adjust our current framework to look at this, because it's really starting to resonate with individuals. One thing I will say was really interesting. We were running a workshop, and there was our surgical team that sort of ran through a project, which was their Bring Your Own Bag project, where during day surgery, patients bring their own bag and the water bottle. And they ran through the process map, and they just had implemented this project. And it was a change management project. And there were some unintended consequences of that project. But when we actually did the process map for this, they were like, if we only had this framework, we would actually have recognized some of the social impacts we were having, and we would have been able to address them, making that change management piece a lot more easier. So I'm almost using the SUSQI framework, embedding it, and then looking at smaller projects that we can then spread and scale, because we are now looking at the lens of this through the triple bottom line. So it's been just a really effective tool to get across some of the great projects and works that people are doing, but to make sure that change management piece is it runs a bit more seamlessly. Without, when you don't do it, it's very different versus when you actually do it.
Fantastic. I mean, you both really clearly articulated the connection between health, care, and the planet's health. You've helped us really think about how to make the case for this using the triple bottom line. You've helped bring it to life with some stories and examples, and really brought to life the practical nature with which teams can actually go about really thinking about what they can do on this aspect of quality and care. I wonder if I might ask you a final question as we get to the end of this episode, and it's to sort of think ahead a little bit about what the future of this field might look like. Um, if we were having another conversation in, say, 5 years' time, what do you see may be the place we're in terms of the connection between sustainable healthcare, the climate, and the use of improvement, perhaps?
I don't know if we'll be there in 5 years, but I genuinely believe that this should just be part of all quality improvement. Because if you are making a change and you're making your system less sustainable, then that's the wrong change to make, So you'll need to be making a lot of accommodations and mitigations elsewhere. So I think I think it's very important because there has been a tendency in the past to present sustainability as a trade-off with good clinical care, and actually that is just the wrong way of going about it, because if you need your service to be more sustainable and higher value, higher quality, well then you set those as your goals and you innovate towards them and you improve towards them.
That's great. Thanks, Francis. And Bhavani, what might be your predictions for 5 years from now?
Yeah, it's tough to make these changes in 5 years, but we're moving towards what we call value-based care, and I see quality improvement as integral to value-based care. And as Francis has said, that there is this sort of misconception that there's a trade-off if you're sustainable. You're not providing quality care, which is completely wrong. And we know that regulations sort of hinder some of this work as well. That is an obstacle we have to overcome, because often there's conflict between your infectious disease protocol versus sustainability. I hope in 5 years that I could show H as an example of provincially being able to spread this. I think we're in a very, very unique position in Canada. We know that many health authorities are using quality improvement to embed this work, but the uptake and the appetite from across so far our Calgary zone has been immense. Everyone is looking at this. So I do hope that this becomes an integral part of our AIW framework, and that's going to be immense work in 5 years. That's my hope. I think it's going to be tough to move all systems to net zero, because there's so many competing demands for us being healthcare workforce and other demands that are put on us. But I do hope we can get there, and I think quality improvement is an absolutely excellent vehicle for some of this work. And it's when you have an infrastructure like we do, I think it's a easy win for us. So I hope we'll get there, but we know there's going to be roadblocks and barriers as well along the way.
I've no doubt at all that your health system will be a beacon for us all to learn from over the next 5 years. No doubt at
So
all. And Francis, like the organisation that you are leading, a Centre for Sustainable Healthcare, also is going to become even more prominent globally in helping us all think about this topic. I personally can't see a future in which sustainability is not recognised as a domain of quality, and that when we're designing health systems, when we're improving health systems, it's given equal weight to the other domains of quality. I think that's the only real way to view it, and to make sure it's really integrated into the way we think, the way we work. Bhavani, Francis, it's been a fascinating conversation. Thank you so much, both of you, for joining me today. And I know our listeners really enjoyed listening to you both. Thank you very much. So to all of you who've been listening into this episode, thank you so much for joining us. And I look forward to seeing you on the very next episode in this podcast series of Conversations in Health and Care. Thank you very much.